Staying with us, if you're a member of the Discovery Medical Aid Scheme, you'll be pleased to know that the company says it's ready to vaccinate about 40 to 50,000 people daily once the vaccination program in the country finally gets underway. It made the announcement saying it's ready to launch the program on the 1st of May, should vaccine supplies allow. Let's discuss this further. I'm joined by Discovery Health CEO Ryan Noach, who's joining us by Skype. Ryan, a very good evening to you. Thank you so much for your time. And that's just the one tricky bit, isn't it, about your readiness, that it's an impressive plan on paper, but the supply of vaccines is at this point out of your hands?
Yes, well, it's more than on paper. It's very tangible. It takes hundreds of people, lots of sites, and a big financial investment that we've made. But you're right, Tembekile, it really does depend on the supply of vaccines. We've worked very closely with Business for South Africa and with the Department of Health to ensure that adequate vaccines have been procured, and we hope it will be ready by 1 May.
And once the vaccines begin to arrive, because Health Minister eNCA speaking this week has said the target is now for about mid-April for the first serious consignments for that rollout of ordinary South Africans to begin, right? Once those consignments begin to arrive, how will the doses be allocated to medical aids such as yourselves? How much will you receive?
That hasn't been confirmed as yet. What we do know, as per the Cabinet announcement from earlier in the week, is that the plan is to vaccinate 1.5 million healthcare workers in phase 1 by the end of April. That's the government's plan, and so far about 250,000 short of have been done already, so another 1.25 million. And then phase 2 begins in May. That's when the majority of the volume is required. And this is to cover the people who are at higher risk of contracting COVID-19. We're waiting for the final details of how it will be allocated between the public and the private sector, and within the private sector. We want to make sure we're ready to move the moment we get supply. Speed is very important here.
And you aim, or you set yourself a target to vaccinate by the end of June all the high-risk South Africans, should things roll according to plan. Talk to us more about the detail of this rollout and how you're going to do it, from identifying the specific people to when they ultimately receive a shot in the arm.
Well, the country's plan, as communicated in the Cabinet communique, is to complete phase 2, which is the high-risk people and the elderly, as well as some essential workers in various occupational categories, by October. It seems very clear, based on the advice from the Ministerial Advisory Committee, that the high risk should be done first. At Discovery, we have 550,000 high-risk members who fall into these high-risk categories. We will definitely vaccinate them first and give them priority access. We think we can do between 40 and 50,000 vaccines a day. And so to reach those 550,000, we're hoping that once we've got supply and contingent on supply, we can get this done by mid-June latest.
And there's a great deal of frustration, Ryan, this week about the fact that we're sitting now at the end of March. The goal was initially that we would have vaccinated about 1 million South Africans by the end of this month. It hasn't happened. We're going to miss that target. The country is also likely to miss that target of vaccinating about 67% of the population by the end of the year. Do you share the frustration as Discovery Health of ordinary South Africans with this delay?
Absolutely. I think we're all frustrated, including the leaders within the Department of Health, by the complexity, the sophistication, and the difficulties that we've encountered in procuring the vaccines as a country. Global demand is at an all-time high, yet supply is not. Supply is constrained, and there are also some contractual complexities associated with securing these vaccines in the country. This has all been overcome now. This complex problem, we believe, has been solved. The Minister of Health has now confirmed deals for about 31 million doses of the vaccines, and the importance now is to get them in as quickly as possible. We need to try and push the manufacturers to advance those doses into Q2 so that we can get them before June, and we can really commence in earnest.
I'm glad you bring that up, because watching a lot of the reaction from South Africans who are rightly frustrated with the fact that we don't have an official vaccine rollout currently, a lot of them are saying, well, leave it to the medical aids and private entities to do this. It would happen quicker than what government is doing. But the reality is, as you rightly point out, even if Discovery were to put in an order now, these are not vaccines that would arrive by the millions next week or even in a month or two, correct?
Absolutely right. And countries around the world are all buying centrally. Central procurement and coordination of these national vaccination campaigns is important. Manufacturers are dealing exclusively with governments in order to ensure that there's not a fragmentation of the strategy and issues that arise within each country. And so really it is, as you say, Tembekile, about speed. Now that we've managed to secure sufficient doses, we must push the manufacturers to meet their commitments of getting these in as early as possible. We want them now in Q2.
Ryan Noach, I could not agree more, the CEO of Discovery Health, speaking to us there about the company's readiness to roll out COVID-19 vaccines once we received those consignments, ordered, of course, through the government. Now,